Welcome to this webinar on presenting and managing repetitive strain injuries, or RSI. My name is Karen O'Hara and I'm a physiotherapist based in London. This webinar aims to cover what RSI is, identifying the symptoms and common injuries, the causes of RSI, and what we can do to decrease the risk of developing RSI, and ways to manage RSI. So what is a repetitive strain injury? It can be divided as a group of injuries affecting muscles, tendons and nerves, primarily of the neck and upper limbs. It's an increasing problem due to the intensive use of computers and postural related problems due to the sedentary nature of many jobs today. It can be divided into two types: specific conditions like tennis elbow, carpal tunnel syndrome, or diffuse, where there's no obvious injury, but a vague cluster of symptoms. So let's look at some common causes. RSI is caused by a combination of factors like overuse and repetition of tasks, for example, prolonged typing or the use of mouse work or repetitive lifting. Awkward or static postures, so poor workstation setup, sitting for a prolonged period of time, not using a headset if you use the telephone a lot at work, insufficient recovery time, so not taking breaks away from repetitive tasks, and not giving muscles, tendons and nerves enough recovery or rest time. The use of vibration equipment like drills and hammer action tools can also contribute to RSI. Working from home may contribute to the development of RSI. So poor workstation setup, unlike your office setup at work, forces you into awkward sitting positions. Difficulty separating workspace from home space makes it difficult to switch off, and it may cause you to work longer hours, which may lead to stress, fatigue, and less breaks throughout the day. I recommend that you look at our webinar, Preventing and Decreasing Muscle and Joint Pain, for guidance on workstation setup when working from home and planning your schedule when working from home. RSI can create a wide range of symptoms. You may notice them more during the day when you're doing the activities that increase these symptoms. Some of the typical symptoms include aches, especially in the neck and shoulder region, stiffness, most commonly in the neck and the upper back, swelling if a tendon or muscle is inflamed due to repetitive strain, or oftentimes tingling or numbness in the arm or into the hand if there's neural irritation present. If your symptoms get better with rest, then it's advised you change your activities or adapt your workstation setup or environment. And if your pain continues to get worse, it's advisable you speak to your GP or physiotherapist. So common types of RSI can be identified by the soft tissue structures that are irritated. So neural irritation of the nerves that exit the neck and supply the upper limbs can cause neck pain, numbness, tingling or shooting pain down your arm. Muscles can suffer from tension, strain, and can give a sensation of achiness. Tendons can be affected, most commonly the tendons involved in tennis elbow and golfer's elbow. Sometimes individuals will have more than one structure involved in their RSI. Now, let's look more closely at the most common RSI conditions. The first being tennis elbow. So this condition affects a tendon at the outside of your elbow, which becomes overloaded and irritated. And it's a very common condition when those aged from 40 to 50 years. Some of the common symptoms of tennis elbow include pain and tenderness on the outer side of the elbow, which can radiate into the muscles of the forearm. Also, reduced grip strength can be a common cause of tennis elbow, and activities that increase pain, like gripping and lifting activities, such as opening doors or opening jars. It's not uncommon for mild swelling to develop on the lateral side of the elbow as a result of tennis elbow. Now we'll look at some exercises to help with the symptoms of tennis elbow. The first exercise involves you sitting down on a chair with palm facing down. Lift the involved wrist using the opposite hand. Once in the elevated position, let the wrist come down slowly back to the starting point, controlling the downward movement. Lift back the wrist with the opposite hand and repeat the movement. There should be no or minimal pain or discomfort when doing this exercise, and aim to complete 8 to 10 reps if you can. The second exercise is a stretch for the muscles of your forearm. Extend your arm out straight with your elbow straight and use the other hand to grasp it at the side of the thumb. Bend your wrists down and feel a gentle stretch. It should not be painful. What you should feel is a gentle stretch, and hold for about 15 to 20 seconds. And you can repeat this 3 to 4 times. Exercise 3. Place the affected arm and hand on a table with the palm facing down. Hold it down with one hand. Keep your elbow on the table and try to raise your hand against the resistance of your top hand. Hold for 2 to 3 seconds and repeat. Again, there should be minimal or no pain. And again, you can complete 8 to 10 repetitions if you can of this exercise. Now let's look at another common condition of golfer's elbow. It's similar to tennis elbow, but it's on the inside of the wrist that you'll experience pain. It's less common than tennis elbow, and its main causes are activities that involve gripping, repetitive elbow movements, like playing golf, and movements involving vibration tools. The main symptoms with golfer's elbow is pain and tenderness on the inside of the elbow, and sometimes a reduction in grip strength of the hand. Oftentimes, tingling and numbness may occur into the ring and little finger. Exercises for golfer's elbow are slightly different to those for tennis elbow, with the palm facing upwards instead of downwards. And let's go through 3 specific exercises to help with the symptoms of golfer's elbow. Exercise 1 involves placing the affected arm and hand on a table with the palm facing up. Hold it down with the other hand. Keep your elbow on the table and try to raise your hand against the resistance of your top hand. Hold for 2 to 3 seconds and repeat. Again, there should be no or minimal pain when completing the exercise. Exercise 2, place the affected arm and wrist on a table with the palm facing down. Lift the involved wrist using the opposite hand. Once in an elevated position, let the wrist come down slowly back to the starting position, controlling the downward movement. Repeat the process until fatigue, and again, there should be no or minimal pain. Exercise 3 involves stretching the arms of your forearm. Extend the affected arm out straight with the elbow straight, with your palm facing up. Use the other hand to grasp the fingers and pull your fingers back. Feel a gentle stretch along the bottom of your arm and wrist area. Hold the stretch for about 15 to 20 seconds And again, you can repeat 3 to 4 times. Finally, we'll look at another common condition called the Quervain's tenosynovitis. It affects the area around the thumb. 2 of the tendons on the top and base of the thumb become inflamed and irritated. Pain is normally felt at the base of the thumb with swelling, and the first sign of this condition is normally soreness on the thumb side of the forearm. It's normally aggravated by pinching and gripping movements involving the thumb. Let's look at 3 exercises specifically for this condition. So the first exercise involves you placing the affected hand palm down on a table. Using your good hand, gently move your affected thumb away from the table and slowly bring your thumb back to the table in line with your fingers. Complete 5 to 10 repetitions of this movement. Exercise 2, place your affected hand on a table. Using your good hand, move your affected thumb away from your fingers. Slowly bring your thumb back in line with your finger. Again, you can complete 5 to 10 repetitions of this exercise. And exercise 3, support your forearm on the table with your wrist on the edge of the table and thumb pointing upwards. Slowly lower your wrist towards the floor until you start to feel discomfort, and use the other hand to return your wrist to the starting position. Again, these exercises should cause minimal pain and discomfort and aim to complete 5 to 10 repetitions every 2 hours. Now let's look at some self-management strategies that we can help to reduce the symptoms of RSI. So the first one is reducing our activity. So try having a complete break from the activities that are triggering your symptoms and then gradually reintroduce them. If this is not practical, then limit the amount of time you spend at these activities. Another method is the use of heat and cold compression. Applying cold packs to the affected part of your body will help with pain and swelling. You can use the packs for about 15 to 20 minutes at a time, but be careful not to apply ice directly onto your skin, as it may cause burning of the skin. If ice doesn't work for you, you could try some heat treatment, so hot packs or a hot water bottle instead. Option 3 is adapting your work environment or your workstation setup. If symptoms are related to your work, your first step should be to speak to your manager or occupational health department, and they can organize an assessment of your workstation to ensure that everything is set up ergonomically in the correct way. Option 3 is painkillers in the short term, such as over-the-counter paracetamol or non-inflammatory steroids. But please speak to your pharmacist or GP regarding the advice of taking painkillers. The fourth option is exercises, like the exercises that we just went through. So some general tips to reduce the risk of developing RSI. The first is looking at your working habits and day-to-day activities. So pacing yourself throughout the day, so trying to prioritize your workload, avoid cramming different types of work into your work day, making sure that you're taking regular breaks to stretch and change positions, and ensuring that your work environment is set up correctly. Next is general lifestyle, so managing your stress levels on a day-to-day basis in a healthy way. So this could be through mindfulness, exercise, or better time management skills. Ensuring that you are getting enough regular exercise, following a healthy diet, and trying to avoid smoking, as it can reduce blood flow and decrease healing and recovery within the body. For further support, please visit bupa.co.uk/coronavirus or bupa.co.uk health-information/health-blog. And just to end, a quick summary of what we've discussed today. Make sure your workstation is set up correctly and you have the correct working environment. Keep moving throughout the day and try some simple exercises and to minimize your symptoms.